Welcome into the Family Pet Podcast, the podcast for curious pet parents, where we believe the more you know about pet healthcare, the better pet parent you can be. I'm your host, Michael Shirley, for episode 96, joined once more by co-host and brother, Stephen. Welcome in, brother.
Hi, brother. You sound a little hoarse.
I am a little hoarse. I went and cheered on...
Not a little lightning?
Not a little lightning, a little Pegasus, actually. I went and cheered on the Lady Raiders from MTSU. They were playing in the Conference USA tournament this weekend, and I don't know if our listeners know this or not, but I was a cheerleader in college.
And let's refine that. You were on the cheer squad.
I was a scholarship athlete for 2 years. I was the mascot at MTSU, which is a hard job for me because you can't make any noise. You're not allowed to talk.
And it gets really warm in that thing.
It's really hot in there. But I was not in the uniform this weekend. I was in the stands with our younger brother David and my son MJ, who had the megaphone. I passed that on to him. He was leading cheers. It was great.
I saw the video.
The downside is I am a little hoarse today, but that's okay because I'm not going to be doing all the talking today. We have another great guest today to talk to. All of you curious pet parents out there, if you're watching, you can see her. We are joined by Dr. Angela Briggs. She is a boarded veterinary dentist. Stephen, we haven't had a boarded veterinary dentist on before.
No, we had a veterinary
technician specialist, VTS, in dentistry. Doctor. She's a smart, I think, as a doctor. But that was Benita Altier, who is a VTS, a veterinary technician specialist in dentistry. That was like a year ago, wasn't it?
Yes, that was that VMS we recorded it. So we really ought to annual dental care at the veterinarian is important. So every year there's going to be a dentistry episode.
Now February, we should have done this in February, which was Dental Awareness Month.
I believe Dr. Briggs has a quote.
Okay,
from a blog post.
Well, I know what it is, and I agree with her, so we'll just stop talking. But Dr. Briggs, thank you for joining the Family Pet Podcast today. Well, like I said, so at Family Pet Health, our veterinary practice that we have, one of our goals for this year in 2024 is to increase our dentistry compliance rate for our patients by 10%. And we just had our quarterly meeting today. In the first quarter of last year, we did 31 preventative, cleanings, preventative. I'll call it preventative maintenance. This year we did 41. So we are already growing. Yeah.
30% increase.
That's right. I wish I knew which one of these buttons was the applause.
Don't hit the wrong one.
But yeah. So dentistry is something that's really important. Obviously, you're passionate about it, I would say.
Absolutely.
But like Stephen and I talked about, we've done one episode dedicated to dentistry before, but we've never had a boarded dentist on like yourself. So can you tell our curious pet parents out there, what is a board certified veterinary dentist, and how do your services differ than those that their regular primary care veterinarian might provide?
Yeah, absolutely. I always kind of joke, we're kind of like the Liam Neesons of veterinary medicine. Like a lot of people don't know that we exist, and we have a very special set of skills. And so there are only a few hundred of us.
Yeah.
What was that?
I was saying, but will you come find us?
Yeah. I will find your patients that need us. How about that?
That's very good.
But there are only a few hundred of us in the world. And so, the nice thing about veterinary dentistry is that it can take its own shape on any day, on any given basis. And so there are times where we do a lot of preventative oral health, especially with patients with comorbidities. If a patient has cardiac disease or kidney disease, and they're like some special fine-tuned anesthetic protocols that we need to use for them. But we also treat things like jaw fractures and oral tumors, root canals and crown placements in dogs, root canals in cats. We don't do crowns in cats. And so it's so great to be a part of this because of the amount that we can see on any day. It's always a surprise. Every patient is different.
What are some of the most common conditions that you would see as a specialist like yourself?
Yeah, so we see a lot of fractured teeth. So, like I was talking about root canal therapy. And so we utilize root canal therapy on specific patients and often specific teeth. And so, especially when we're talking about young, large dogs, if they fracture a canine, those canines function as their hands. So, sure, they can survive if we extract one, but aren't they better if they are able to keep all of those canines? And so that's what they're picking up with. That's how they're doing all of their apprehension. That's most of their play is happening with their canines. It's not necessarily the teeth that they're chewing with, but it's still some of the most important functional and structurally important teeth. So we do a lot of root canal therapy to save those teeth. And then a lot of times, unfortunately, because just the nature of the game. We don't do historically in veterinary medicine, as you guys were just talking about, we don't do enough preventative oral health care with routine cleanings, routine evaluations under anesthesia. That's the key is yes, they have to go under anesthesia for it, unfortunately. But it ends up being a lot of times where we're doing full mouth extractions because of advanced periodontal disease, which is the bone loss and the infection, and sometimes even tooth root abscesses coming up secondary to all of that. So,
Now, as we talk about a fractured tooth, um, especially a canine, I think of Maverick, my German Shepherd. He's 5 years old, so he's got big front teeth, those
huge.
canine
Yeah.
teeth. That if one of those breaks, what just kind of walk through that process. What does that mean that you're going to do a root canal or
You talking about the incisors or the canine teeth?
I'm talking about the canine, the four big teeth that if one of those breaks.
Yep.
Yeah. So criteria for whether or not we're able to actually save the tooth with root canal therapy, a couple of different things. One, it has to be where the root itself looks good and healthy. So sometimes these teeth have been broken for a long time and people may not notice. Maybe they're not looking in their dog's mouth. Maybe the dogs don't want them or don't allow people to look in their mouth frequently enough. And that can cause structural changes to the root. And not just a tooth root abscess, we can deal with the tooth root abscess, but if the root structure itself is changed, then we don't always have the success that we want to see with root canal therapy. Additionally, we have to evaluate how much of the tooth is still left. So oftentimes, if the crown is fractured along with the root, then a lot of times we're not able to save it. If it goes under the gum line just a tiny bit, we may be able to save that tooth with root canal therapy. So first off, we first determine, is this tooth able to be saved with root canal? And let's say absolutely it checks all the boxes. It's a strictly crown fracture. The root looks great. It's a big, large dog. The last thing anybody wants to do is extract that tooth because it's a beast to get out. And then we do a root canal. So what a root canal is going in and cleaning out the pulp chamber. So within 2 weeks of a fractured tooth, the pulp is dead. All the bacteria has gotten in there. It's killed that tooth. Infection's already setting up. Whether or not you can see it radiographically or more specifically on cone beam CT is a little bit more sensitive than intraoral radiographs. But either way, histologically, we know that infection is there at about 2 weeks. So, or which is looking underneath the microscope, right? If we were to look at the microscope and look for bacteria, we know that it's there in about 2 weeks. So what you do is we have these special files that some of them are like 70 millimeters long because of how long some teeth are in these big, especially German Shepherds. And so we are filing out all of the pulp chamber. We are disinfecting the pulp, and then we are placing an endodontic cement, the exact same that your human endodontist or human dentist would do for your own root canal therapy. What we don't do a little bit differently is we never really build that crown back up like they would for us as humans, right? Because one, our dogs and cats, fortunately, they don't have the vanity that we have. So they are not worried about exactly what their teeth look like. But also their forces with their jaws are too strong. They would never be able to withhold that structure if we tried to build the crown back up, especially let's talk about like again a German Shepherd canine. If we tried to build that crown back up, it would fracture off. And so sometimes we also go on top of that and place a titanium or metal crown kind of to act as a helmet on top of it, depending on how much trauma was there, what the dog's being used for, how much they're going to be using those teeth in the future, that kind of thing.
I can just picture a grill, gold grill on my
Maverick
dog.
with the grill.
Yeah, I've had a few people ask if they can get some blinged crowns, and unfortunately my answer is always no.
Not yet. Not yet. So, what about cats? Do we do the same with the cats?
So cats, very similar. The only teeth that we would root canal for a cat are the canines. No crowns for them. Their teeth just aren't structurally sound enough to support the crown prep and the weight of an actual titanium crown on there. And porcelain crowns, again, we just don't really use those in veterinary medicine very often. There are a few people who will, but again, a lot of times they just don't withstand the forces of them. But a root canal in a cat is a little bit harder for criteria wise, because those cats, they love to break down their roots for various reasons. And so oftentimes that the root is already compromised. But actually I did a root canal on my cat, on one of his canines. He was an indoor outdoor cat. During my residency, found a fractured canine and did his little root canal, and it's great because then they go home, there are no sutures, right? Especially with him being outside, him being able to keep his defensive canines. It's just a little more blunted than the others. So
I would like for you to explain the structure of a tooth. So I heard a few terms that I'd like for us to define for our curious
Absolutely.
pet parents out there, and let us know if there's a difference between the canine mouth and the feline mouth. I heard you say crown, roots,
Yep.
and pulp chamber.
Yeah.
Are there any other structural pieces besides those three to a tooth?
So those are kind of the main three. If you were to break it down, there's a lot more to the tooth, and to the tooth periodontal complex. There are lots of fibers. There are supporting fibers. The gingiva is technically part of the supporting tooth structure. But the crown is the visible portion of the tooth, right? So when we smile or we lift our dogs and cats' lip up, the crown is what you can visibly see above the gum line, that are actually the functional portion of the teeth. And then the root encompasses everything under the gum line. And in our dogs and cats, that's about 2/3 of the tooth. So again, let's go back to those German Shepherds, right? The crown of their teeth are huge. Imagine the fact that the root to that canine is even bigger than the exact same portion of the crown. And then the pulp chamber is where our blood vessels, our nerves, everything that feeds the tooth and keeps it alive, because the tooth is alive for most of us, unless it has died for various reasons via infection or trauma. The tooth is alive. And so within that pulp, that's where we get our blood supply. That's where the nerves live, everything like that, that maintain the vitality of that tooth.
So it sounds like a tooth is similar to an iceberg. You can see a portion, but there's so much underneath.
Absolutely.
So
Yeah,
with that in
just
mind, if there's that much, 2/3 of the tooth is out of view, how do you assess the health of that 2/3, the root? How do you assess the health?
Yeah, that's a great question. And this goes back to why anesthetic dentistry is a must, because the only way to assess below the gum line is under anesthesia with intraoral radiographs, dental x-rays. And so they are absolutely imperative. And so, we kind of think about veterinary dentistry is not for cosmetics. It is truly a medical tool, right? We are improving their oral health. We are removing sources of pain and infection. And if you are taking your patient or your pet for a cleaning and the pet is not under anesthesia, all they can do is remove what looks not so great on the surface, but that's really not what's causing the disease. So getting them under anesthesia, probing and measuring each individual tooth. We check for something called periodontal pockets, which are normal to a certain degree. So we always want to make sure, and that varies from size of our patient as well as species. So dogs and cats, it's different. And a Yorkie is going to be very different than a Labrador Retriever or German Shepherd. And then again, full intraoral x-rays or dental x-rays are a must for every patient once a year. Not necessarily every single time if they're going under more than that, but once a year.
When I hear roots, I think of a plant that absorbs things from underground, through the roots and then transports it up through the plant. Is that what's happening with our pets' teeth, that they're below the gum line in the roots? They're attaching to the jaw and the tissue in the jaw, and how does that nutrients and blood flow, does it come in all around the root, or does it just come through the very bottom of the root into the tooth?
Yeah, so dogs and cats have what's called an apical delta. And so basically it's very similar to like the roots of a tree or a plant where they have all these open pores and everything. Because the root structure itself actually closes in dogs and cats, whereas with us and humans, it doesn't. And so that's why our teeth shift versus our veterinary patients. Once we extract teeth, their teeth aren't shifting because the roots are closed. But absolutely. So we know that any illness within their system can affect their teeth, but also vice versa, right? Any infection that's in their mouth can affect other organs. It can go to the heart, it can go to the liver, it can go to the kidneys. And it's a hard thing to fight when you've got these chronic oral infections, for sure.
When you do a root canal, do you remove the infection and the dead parts of the root or the pulp chamber, and then I heard you fill it?
Mm-hmm.
Okay. How do you get into where do you make how do you get into the pulp cavity?
That's a great question. Sometimes, depending on how the fracture is, we're able to enter through the fracture itself. Let's say maybe the tooth isn't fractured at all. And like we see a lot of concussive injuries that can actually kill a tooth. That classic kind of purple blue tooth that a lot of veterinarians see, and tug of war is like the big culprit, just grabbing that rope and pulling, and it just pops that tooth out of the socket and damages the vessels, but the tooth isn't fractured.
Okay.
So you can then enter through, we have specific entrance points that we are able to map out on every single tooth. If we were to do root canals on incisors or premolars, which we do sometimes do as well. But usually it's called straight line access. That's your goal. And so you want to have basically the easiest entrance point directly in. So it's usually right at the gum line for the canines, a little bit above the gum line. And then on the upper fourth premolar, which is another common tooth that we do root canal therapy on, that has 3 roots. So you have to access it through either 2 access points, or some people do 3 separate ones. But most of us these days do 2 separate ones and are able to access 2 of the 3 of the roots at the same access point.
And so most general practice veterinarians aren't doing root canals, is what I'm.
Correct.
Yeah.
The amount of kind of training that goes into mapping out this tooth, but also just the tools to have. It's very expensive. The endodontic cements aren't inexpensive, and so I know of a few general practitioners that have previously gone through like a fellowship program that are doing it, but typically you're going to need to see a veterinary dentist or oral surgeon for that.
How do you know whether you're doing any extraction, or how do you know if you've gotten all the bad stuff out of their mouth, like all the infection and dead tooth pieces and tissue? How do you know that you've gotten all that
for
out?
An extraction?
Mm-hmm.
Yeah.
Or
so
for the root
again,
canal, if you're doing a root canal, you're taking all that.
Yeah. So when we're doing our root canal, because we're just into the pulp chamber itself, we have these dry, they're called paper points, but they're basically just kind of paper cones that we go in. And so we're radiographing it as we're going along. but we're also physically checking the chamber to make sure that there's no debris. The inside of the tooth, when it is infected and dead, it's like black. It's like just not good. So you can really tell when all that stuff is still kind of flushing out. And then with extractions, again, intraoral x-rays, you've got to do x-rays after an extraction to prove that you've done everything. I mean, we've all had moments where even, as a specialist, where we think that we've done a complete extraction, everything looks great. The tooth looks, the root looks intact when we extract it, nothing's fractured off. And there might be a little tiny sliver of something in there on your radiograph.
What with the dental X-rays, dental radiographs, is that something that's becoming more standard across all veterinary practices, or are you seeing more and more general practices having that ability?
I think that it is, and I think that it needs to be. It's certainly now the gold standard, and so it leaves so much potential disease, infection, and complications on the table if you're not doing your intraoral radiographs, and not just selective intraoral radiographs, doing full mouth, looking at every single tooth, because the number of surprises that we see hidden under the gum line, it's just incredible. And so, it's certainly, unfortunately, it's still not in every single practice. But
Well, it's super
I think
expensive. I'll tell our
yes,
curious
the
pet
units
parents
are
out
very
there.
expensive.
Yeah,
Absolutely.
your veterinarian's looking at upwards of $14,000 to $15,000 to add dental radiograph
Absolutely.
capabilities to their office. So it's not something that is lightly. They can't just go, I'll just decide to add this today. I mean, they got to really plan for it. So, and I also want to tell our curious pet parents out there, one of the things that we hear about is, oh, my goodness, why is this so expensive? My dentist doesn't cost that much to get my teeth cleaned or an extraction. And I just want to remind people that our patients don't just say, like we have to.
Maverick will not hold his mouth open for 2 hours for you.
So it's
Right.
and they don't understand the difference between this shot is going to go in your mouth. We're going to put a little numbing cream on your gum line and then give you a shot in the mouth.
Or that little
They don't do well with that. So
Yeah.
I would assume that by the time people come to you, they know it's going to be a little pricey. They know that, but like you said, it's not something that everybody knows how to do. We got to go to a specialist. And you need to be compensated for your knowledge and time and equipment and staff. When our curious pet parents are out there listening, dental health is so important, and I think it's important that you understand why. And talk to your veterinary team about pricing, and they'll explain it to you as well.
But paying for a dental cleaning
Is way cheaper than
once a year is so much less expensive
Absolutely.
than paying for a full mouth extraction at year 12.
Absolutely. Hands down. Absolutely.
You mentioned injuries, playing tug of war with your dog. I assume I don't think anybody plays tug of war with their cat, not in a violent way like that. But what are some other common causes of injuries to the teeth?
Yeah, it's I like to joke that I ruin people's lives because I tell them they've got to get rid of basically every toy that their dog probably loves, right? So I'm like, get rid of the antlers, get rid of the bully sticks, anything that is hard where it doesn't have a little bit of a give to it. If you hit your knee to it, or if you hit it on your knee, if it hurts you, it's too hard for their teeth. Tennis balls can destroy teeth. Yeah, it's the surface of them.
Yeah.
It's so abrasive. It's like taking sandpaper and just filing down their teeth.
Mavericks canine teeth
are worn down.
The top amount is they're shortened by at least 15%.
Well, you know what the solution is. You need to get your dogs registered for the annual Walk My Dog Challenge, so you can get one of our custom squeaky balls, which are very nice and soft. They are a little bit annoying.
Well, they're about annoying for about 2 weeks until the dog punctures.
We gave a new one to we have a border terrier, and we gave a new one to her, and I watched her strategically pull the squeaker out of it. I was like, what? That lasted like 5 seconds.
Like, this is annoying to me too.
But let me ask you this. She loves taking toys, whatever it is that you're playing with her. she's a border terrier, so she's bred for hunting, things in the ground and shaking them until they're no longer alive. She loves grabbing soft toys and things and shaking them back and forth. Is she at risk of hurting her teeth that
As
way?
long as somebody's not on the other end, it's really just the
Okay.
forces, and I always joke, you do the best that you can. If you've got two dogs in the house that are playing
Yeah.
tug of war with each other, right? There's only so much you can do. But I think just like all day, every day, right? Like minimizing risk, putting on your seatbelt, putting on your helmet
Right.
when you're riding a bike. It's no different with our patients with our kind of oral trauma.
Injuries for cats. What seems to be the most common reason that they're coming to see you? Is it injuries or is it just bad oral health?
It's a little bit of both. So we do see a lot of jaw fractures in cats, whether it's from a fall or whether it's from being attacked by a dog, like let's say they're outside cat. But cats have so many different subsets of oral disease that we see compared to dogs. Some classic things that we see a lot of are cats with stomatitis. So some feline pet owners may know about that term, or tooth resorption. They're really very specific to cats.
All right, you said it. It is something that I have seen. I don't own cats.
You're missing out.
I'm not crying
That's right.
today. So one of the things that I see on the bills or on the notes is resorptive lesion, and you just mentioned it, and it's only with cats that I see it on these records. What is that?
Yeah. So we do see there are different types of tooth resorption that we see in dogs, but when we talk about resorptive lesions in cats, it's a completely different situation. And so
we're at
we don't
27 minutes.
we don't fully understand why it happens. We know that it also happens to our wild cats, right? So we see it in lions, we see it in tigers, we see it in lynxes. So it's not, we used to think maybe it was diet related to our domestic cats. We now know that's not really the case. And so we don't really understand why it happens, but upwards of 60% of cats may have tooth resorption at some point in their life. Sometimes it's one tooth, sometimes it's a domino effect and every single tooth gets affected. But basically, the tooth starts to break down from the inside out for one reason or another. Some type of inflammatory response gets triggered. And I say it's basically the world's worst cavity. Because just like how we talked about when a tooth fractures in a dog, that tooth is dead within 2 weeks. These teeth in cats, they don't die. So the nerves are firing constantly, nonstop. It's excruciatingly painful.
Wow. But just an annual exam, not the dental cleaning, but an annual exam, the veterinarian can see that at that time?
Sometimes you can. Sometimes they're really tiny lesions that are really hard to see. Sometimes they're so advanced that it looks like they've fractured half of their tooth off. And it just depends on the stage. There are 5 stages as they advance. And so the first stage is almost, you really can't see it. But then by the time you get to stage 5, you've almost missed it all, where literally, and because cats are kind of like aliens, they're just crazy healers. They will literally they'll break down the whole tooth, and then they'll take their gum tissue and they'll seal it back over and they'll fix the problem, right? So once you see a stage 5, you've kind of already missed it. But usually there are other teeth that are at different stages that then you can see.
But the fact that they can heal over does not negate that they're in a lot of pain in that whole time. So you may see weight loss, stopping eating, refusal of treats and things, and laying around, lethargy. Those are all signs that something's going on. As you've heard, if you've listened to our podcast for any length of time, folks, you know that there's a lot of reasons that cats could do that. So if you're noticing those changes, get an appointment scheduled with your veterinarian and make sure that an oral check is a part of that, which it will be.
Yeah,
well, good. Well, Dr.
Extremely
Briggs,
painful.
We're like 29 minutes and I feel like we haven't even scratched the surface here. But we do want to ask you, what are your top 3 things that you wish every dog owner would consider about their dog's dental health?
Okay, top 3 things for dogs. Brushing your dog's teeth or doing an oral health care regimen, minimum every other day. If you're not doing it a minimum of every other day, it's not enough. Number 2 is if you have bully sticks and you have deer antlers and you have hooves, get rid of them. Otherwise, save that money because you're probably going to need to see me for a root canal soon. Number 3 is it really goes back to what you guys said at the beginning. Preventative annual oral health is a must. Oral health care is a must for those guys.
I can hear all the weeping and gnashing of teeth out there for the people with treats, dog chew toys and things. If you can't, one of my friends, Dr. Howden Chrisman, talks about if you can't pick it or put a dent in it with your thumbnail.
Indent it with your thumb. Yep.
Then it's too hard.
Yep. That's another great tool. Mm-hmm.
I will say,
check method.
I took the tennis balls away from Maverick after the fact. He doesn't miss those. We have the squeaky ball. You just have to replace it with an appropriate toy.
I'm glad to know that we chose the squeaky balls versus the branded tennis balls because I would hate to be giving out branded tennis balls that are just destroying pets' teeth. So
I do have a question real quick.
Nothing you ask is quick.
Oh, hush on. There's the certification approved dental product code.
Yeah, the VOHC, the Veterinary Oral Health Council. Mm-hmm.
Do they brand the chew toys as well?
No. So that specifically, and so what they do, they're an independent health council, and they set up basically check marks for a company to prove that their product is effective, right? So I always say, I could create a tooth and no one's going to tell me that I can't do that. Legally, they can't say no, but I also don't have to prove that it really is doing anything. So, I always say, if we're going to take the time, put in the effort and spend the money, let's use some products that have been proven to be effective, at least to some degree, rather than just going and, because we all know you go, I don't know how many of us are still going to PetSmart these days, but you get on Chewy.com and you're just inundated with all of the oral health chews and products. And, you choose one that's got a cute face to it. Maybe it's middle range price and you kind of hope for the best. So going to, it's vohc.org, but they have both lists for dogs and cats for the approved healthcare. That's a great question.
Speaking of cats, what are your top 3 things that you wish every cat owner would consider about their cat's dental health?
Number 1 is you can also maybe brush your cat's teeth. Not all of them, but I would try as a kitten and see how that goes. Most of them will be amenable to it. Number 2 is looking in your cat's mouth, especially if your veterinarian cannot get a good look, looking in your cat's mouth routinely every few months, a couple times a year, so that way you can see what's going on in there. And number 3 is if your veterinarian or if you see a dental specialist says that your cat needs full mouth extractions, your cat's going to be able to eat better than it ever has without having those teeth. I promise.
That's right. That's good. It just came to me. If you are able to look in your cat's mouth at home, have somebody else at your house just pull out your cell phone and record that. Like just use your camera's video and get zoomed in close and try that. That will, and bring that video with you or even email it to your veterinarian if they can accept that. It will help so much because you can pause and zoom in and rewind.
Absolutely.
Yeah. So use the technology that's right there in your hand. Use that technology to your pet's advantage. So, well, Dr. Briggs, before we let you go, it's time in our show where we ask you to bring a little knowledge to our curious pet parents at home with a fun fact for today. This is something that's going to help them win trivia night or at least impress their friends and family at dinner. Dr. Briggs, what is your fun fact for our curious pet parents today?
All right. Fun fact. The most complete dentition of domestic pets is the pig, and they have 44 teeth.
the pig has 44 teeth.
Oh, the grinders, man.
Yep.
Well, the wild
beat out
boars
the
have the
dog.
Tusks. Yeah, the big
Yep.
tusks.
Yep. They beat out the dog that has 42.
Wow. Well, there you go. That sounds like a great trivia question.
dogs have 42 teeth. Pigs have 44. And how many do cats have?
They have 30.
30.
I was
Adult
going to
cats
miss
have
that one. I was
30.
going to say 30. Why was I thinking 32? I don't know. Anyways, 30. Okay, great. Well, Dr. Briggs, thank you so much for bringing all of your experience and expertise to our podcast today. We hope that all of you listeners out there have enjoyed learning a little bit about veterinary dentistry. Please like, follow, share this episode with a friend of yours. Let them know if they have a pet, they need to listen. Every pet owner should listen to this episode of the Family Pet Podcast. And the only way they're going to know about it is if you share it with them. So please do that. And until next time, stay curious. All right. That was a great
That was awesome. Thank you.
episode. Well, thank you very much. We will.